Support for the podcast is brought to you by Home Cooked. Home Cooked understands that as busy parents, you want healthy meals that can be prepared easily, but you often resort to takeout and the same meals over and over by default. Facing a similar scenario herself in 2006, Home Cooked's founder Claire Guarino decided to create a solution so that busy parents could get meals they feel good about onto their families' dinner tables without all the usual time and work. Home cooked meals are delicious and family friendly, super easy prep, and absolutely no slicing or dicing. Their meals can be customized for food allergies, level of spice, and more. Each month they offer 18 plus delicious home cooked entrees, including many gluten-free and vegetarian options. Grab and go meals are available at their retail location in Paoli, or you can place an order in advance for pickup or get your meals delivered depending on your location. Cook them right away or store them in your freezer for later. Learn more or place an order at homecooked.net. Hey everyone, welcome back to Parenting Stuff I Wish I Knew Sooner and I Want You to Know Now. I'm your host, Erica Desper, founder of the Center for Confident Parenting and a mom who just seems to learn everything I need to know the hardest way possible and after I need to know it. And I'm on a mission for that to not happen to you. I want to get you information, support, and resources before you even need them or as soon as you need them. So to that end, my guest today is Brianna Dawson, a board-certified psychiatric nurse practitioner and the owner of Behavioral Wellness for Women, on a mission to provide compassionate, holistic mental health care to women throughout the perinatal period and beyond. Brianna, thank you for joining me today.
Of course. Thank you for having me.
I am excited to. So tell us a little bit about yourself and what brought you to do this kind of work.
Sure, yeah. So my background has always been mental health. So I've been a nurse since 2015 and worked on a lot of inpatient psychiatric units. So that's like my background. And then once I became a psychiatric nurse practitioner, I was looking for a job and just came across a women's wellness clinic, kind of just came upon it and just fell in love with the work. They did a lot of work with women who are pregnant and postpartum. And it was just amazing to see women go through that period and see like the benefits of them receiving the mental health care that they did while they were pregnant and breastfeeding. And
so it kind of found you, which is what most of our guests say.
Yeah. Exactly.
For anyone not familiar with that term, the perinatal period, what time period are we talking about?
Yeah, so we're talking about the period from conception to a year postpartum.
Okay, gotcha. So I think there's a mindset about psychiatry, and I probably shared this mindset at some point, that practitioners just jump to medications. I mean, that is the reason you often see a psychiatrist, and that they maybe treat in a very cookie cutter way. Like, here are the medications that I know of, the 3 that I pick from, and this is what I'm going to give you. But you say in your description of yourself and your mission that you consider the whole person, including biological, psychological, environmental factors. Can you speak to that a bit for anyone who's maybe hesitant to consider psychiatry because of that cookie cutter mentality?
Sure, yeah. So when I say I consider the whole person, it means like definitely in the first evaluation, I'm just really listening to the person's story, considering their upbringing, considering their relationship with movement and exercise, considering their relationship with food, everything like that really impacts mental health, considering their supports. So we really look at every different facet and how it affects their mental health. And then I really value collaboration with other providers. So if there's an area in which we kind of think that we could work on to benefit their mental health, like maybe they want to work on like eating healthier foods, or maybe they're having like pelvic floor issues, there's people that I have that I can refer to them, and we all work together and collaborate as providers to best support the patient's mental health.
I love that. So it's less cookie cutter and more village. It takes a village.
Yeah, very village oriented and very individualized care. So no one person is going to be treated the same.
Yeah, Awesome.
Yeah, and I just
That's
wanted to add that I think people get really nervous when they think of the idea of like a psychiatric nurse practitioner or psychiatrist, but you can see one and not be on medication, or you can just have an initial evaluation and we can just kind of discuss options in terms of medication. And that doesn't mean you have to start it. Maybe you just want to get some more education around it.
Yeah, I think that's really, I was hoping you would add that. I think that's really, really good to know because, yeah, that's not the only reason you would get connected with a psychiatrist. It's an option. Um, and hopefully that will help someone who maybe needs the support but is afraid that they're going to be, guided in that direction heavily. What is it about the perinatal period of a woman's life that might require treatment with someone who's well versed in that period? Like, should we be going to just any psychiatrist as like psychiatrist, right? Or is that not the case?
Yeah, that's a good question. So I think personally, and I could be biased, but I think it's really important
Probably.
probably. But it's really important to see someone who is trained in perinatal mental health, who like has training, who understands the challenges and the different parts that impact women during this period. Um, yeah, there's some providers who believe that, medication should be stopped when a woman becomes pregnant or individual
Hmm.
becomes pregnant. And that's just really not the case anymore. So that's why I think it's really important to go to someone who has specific training so they could appropriately treat you and um, especially the way that you need to be treated and not based it out of like fear of like a medication. Of course, there's risk, benefits, side effects that need to be
Hmm.
reviewed, but yeah.
Got it. Okay. And how can you speak to how common anxiety and depression are or aren't um, along this perinatal journey?
Yeah, 1 in 5 women experience postpartum or perinatal anxiety or depression.
Yeah.
So
So
pretty common.
it's pretty common, and I think another maybe barrier to getting support, well, not maybe, definitely, is the stigma associated with it.
Definitely.
So I think the more we talk about how common it is, can definitely help, with that. What are, since it is so common, what are signs that a parent, a partner, someone supporting that new parent could be looking for to know that this support might be necessary?
Yeah. So some things to look out for are like isolating or withdrawing from others, not being able to like eat, like decrease appetite, not being able to care for yourself, like just bathing, not being able to care for baby, crying, like lots of crying spells, um, increased irritability or rage are some
Mm.
of them.
And
Not
that
being able to
one,
sleep.
yeah, that one I want to stop on the rage because that was not on my radar. I always think of the intrusive thoughts and the being really sad and all of that. But one of my colleagues, when we were learning about this, just to have sort of a basic knowledge, nothing on your level, and try to spot anyone we thought needed support. She had the angry version of it, and I was like, oh, I didn't even know that that was a thing because having not experienced it myself. And I imagine that would feel alarming if you're not that type of person. It's like a what's wrong with me sort of scenario, but it can look like a lot of different things. I hear a lot of women say that they didn't feel bonded with their baby right away, or it persisted beyond the right away. Are either of those signs that we'd look for, or is that just part of this transition?
Yeah, so definitely signs to look out for, as not feeling connected to your baby could be kind of like a manifestation of like depression, anxiety, those overwhelming intrusive thoughts,
Yeah.
difficulty or challenges with feeding, things like that.
Can you speak about it? I didn't prep you for this, but as you're talking, I'm thinking of more questions. How would you explain intrusive thoughts? Because if you don't know what this is and you experience it, you I want to use the word crazy very loosely. Nobody get mad at me for that. You feel crazy.
Yeah, so intrusive thoughts are unwanted thoughts
Mhm.
that pop into your head at any given time. And they may be thoughts that you don't feel are aligned with you. Like the thoughts that you're having, but you're like, I don't want to be having these thoughts. Like, I don't agree with these thoughts. I'm
Right.
afraid of these thoughts.
It could be like thinking about harming your baby or your baby getting harmed, even though that's like is something you would never do. I remember would wear my son to go for a walk in like the long fabric wrap that you tie around the front of you, and I would picture tripping and falling and smushing him. So it wasn't like
Yeah.
I was doing anything to him on purpose. I know it does sometimes manifest that way, but it was still, and it was very graphic what I would picture, and that was so upsetting. I'm like, why would I even think of that? And then I was afraid to take him for a walk, right? So it's a good
Yeah.
start. I still persisted. But is that an example? I've always assumed that that's what that was intrusive
Yeah,
thoughts.
so it's definitely an example of an intrusive thought or intrusive image and can go along with postpartum OCD as well,
Mm.
which can go hand in hand with postpartum anxiety.
Yes. And I've heard that some people get very, they don't want anyone else helping with baby, touching baby. Would that fall in that OCD
Yeah,
category?
yeah, not being able to sleep when the baby's sleeping, continuously checking on the baby, like just watching over the baby and not sleeping,
Right.
like checking to make sure the baby's breathing
Yeah.
constantly.
Which I'm sure we all do. So I guess
Right.
my follow up to that would be, how do we know if this is like, I am a first time parent and I can't believe they let me come home with this human with no training. Nobody checked my references. We all have that moment of like, for real, versus like, okay, that should be sort of getting toned down at this point, but it isn't. Is it how much it's impacting you, how long it's lasting?
Yeah, so I would say if it's lasting 2 weeks or more, and then also if it's impacting your ability to function,
Right.
so your ability to care for yourself, care for a baby, your ability to get adequate sleep, then you
Right.
need things.
Because we all check the monitor or check the
Right.
baby, right? That's not necessarily a
Thank you
flag
for
in and of
clarifying.
itself.
That's
Yeah.
absolutely right.
Because I can hear
Yeah.
some parents listening to this, like, well, why do they make video monitors if I'm not
Right.
supposed to be checking them all the
Yeah,
time?
but it's like
But it's
staring at it like all
right.
night and like not
Yes.
sleeping. That's
I
really
have parents that watch the monitor instead of sleeping when they should be sleeping themselves. And to me, that's a little more like, okay, that's probably something
yeah.
we want to look at. So there are what some would call baby blues, but that tends to happen in the first 2 weeks and it resolves fairly quickly and on its own. So what we're
Correct.
talking about is beyond that.
Right.
Yeah.
Yes.
Okay. Or maybe in that period if it's just super impacting functionality.
Yeah.
Yeah. Anything else you wanted to say about the signs to look for?
Um, in terms of signs to look for, I think no, I don't
Okay,
have
we
anything
got
else.
it. I didn't know if I stepped all over you.
No.
So let's say that maybe a partner or a helper in this person's life is noticing the signs, but the parent that is struggling is not seeing them. How, or like myself as a provider, I will sometimes notice that I think a mom is struggling and I sort of want to broach like, hey, maybe we should bring somebody in. Um, Doing what you do, like, can you give us language? What if you're the partner, what would you say? If you're the other person, what do you say to not, because you got to do this delicately, right?
Yeah, yeah, especially with the stigma that comes along with mental
Yeah.
health, it can be really challenging.
And you're
And
in
for
like one of the most delicate times of your life.
right, yeah, exactly. So yeah, for a partner, I would say to just say, hey, like, is everything okay? Like, check in, just ask them how they're doing. Ask them how you can pitch in, how you can help.
Mhm.
I think just starting there, and maybe they'll give you some suggestions of like maybe you can cook or clean or help doing this with the baby. In terms of getting them to see a mental health professional, just saying, hey, like, what do you think about talking to a therapist? And just kind of normalizing it, or why don't we see a therapist together?
Oh,
Maybe
that's a good
kind of
one.
adding yourself in so it doesn't seem like it's like, oh, there's something wrong with just me.
Right. Yeah, absolutely. Um, and as a recovering person who would not accept help when it was offered, I always like to circle back to that and say, like, if you're dealing with a person who won't give you any suggestions when you ask how to help, like just find something, just do something.
Exactly.
I really want to hold the baby, go take 5 minutes and step outside, or, just notice the dishes or the laundry or whatever it is. Because not all of us will ask, and some of us won't come up with suggestions for various
Right.
reasons.
Yeah. Thank you for adding that.
Yeah,
And yeah, I just want to emphasize that it's not always medication. So sometimes it might just be starting with a therapist who
yeah,
specializes in perinatal mental health. Um, and that I think that that's a very good first option. It could be maybe different if someone's already has been on medication in the past,
right.
or is currently on medication in the postpartum. But yeah, I can't emphasize enough how much therapy is important,
Yeah.
and that could be helpful. And then I find that if that's then, seems to not be alleviating the issues enough, then the therapist typically kind of has an inkling that maybe like medication could be a good fit, and you can consult a psychiatrist or a psychiatric nurse practitioner.
Yeah, so that brings me to another question. If someone already has a mental health history, they've been in therapy and or they've been on medication, and now they are expecting, what would your advice to that person be?
Yeah, so for someone who's expecting, I would definitely say reach out to get established care with a provider that specializes in perinatal mental
Before
health.
the baby arrives.
Yeah, and that's funny
Mhm.
that you mentioned that because someone did reach out to me actually this week because they're
Oh,
like,
good.
I just want to like, be prepared. Let's just set up an
Oh,
evaluation. So then we're established care. They're my client, and then if we need to move forward with medication, we can. But essentially, just get that connection started. So then, if something happens, you have a provider already. You don't have to like be on a wait list or be searching for someone
exactly.
when you need that emergently.
I think
Then
so much about parenting and mental health is reactive. But if we could move towards a more proactive
exactly.
approach, we'd probably all do a little bit better. And you can correct me if I'm wrong, but I'm assuming or making an educated guess that if you have a history, this major life and body transition is likely to trigger, exacerbate, change something. Like you're probably going to need to be treated by someone.
Definitely, like prior mental health history, prior experience of depression, anxiety, mood disorders, definitely increases the risk during the perinatal period and postpartum for
Yeah,
sure.
for sure. Awesome. Okay, so be proactive. Forget the stigma. There's
Yeah,
also a popular thought you mentioned before, I wanted to circle back to, that you can't start mental health medications or stay on your existing medications while pregnant, while breastfeeding. You kind of already said that isn't true or isn't true anymore. Can you touch on that a little bit?
yeah. So, taking medications during pregnancy and breastfeeding has been taboo, and there's a lot more clinical data and information about its safety. And untreated mental health symptoms during pregnancy and postpartum could cause some risk factors, including preterm birth, low birth weight, difficulty attaching to your baby, things like that. So there's some risks, obviously, with taking medication, but untreated mental health symptoms also can cause similar risks
That is
in
so
mother and baby.
important, so important to stress. And just to switch it to like another area. So, we're going through this journey with our son who finally has a diagnosis of ADHD, and the person I'm co-parenting with, we kind of disagree on whether whether to medicate long term because of the potential side effects, risks involved. And there is another piece to that I'm learning about, of like, yeah, but untreated ADHD, particularly as you head into these delicate teen years of like, hey, let's try substances or whatever. You got to weigh the risks of not treating as well, which we don't spend, I don't think, yet enough time talking about. And then I think
Exactly.
another risk of untreated, perinatal mood disorders is the effect on baby in terms of bonding and mental health. You can speak to it better than I can, but there's plenty of research that if the baby's, if mom has sort of a sad, stony
Yeah,
face and the baby's not getting that, happy interactive thing, it's going to impact their development too. So I would just say to a parent, a mom that maybe thinks like, I'll just muddle through, because I don't want to cause any harm by taking medication. Like there may be other
Right.
If you don't want to do it for yourself, maybe consider that you're doing it for your baby, right?
Yeah, it impacts the whole family unit. It impacts, other children that you may have already. It impacts
Mm.
partners, parents,
Yep.
grandparents.
And this is just another reason to maybe consider working with someone who is fresh into the field and then also specialized in the field, because the information about medications and as well as the medications that are available are always changing. So unless
It
you're
is.
really
Yeah.
have your finger on the pulse of that, you may not know. Okay,
Exactly.
awesome. That's really really helpful. So another thing that I think makes moms hesitant to reach out is they're thinking like, well, great. Once I get into this, it's going to be like a lifelong. I'm going to stay on the medication forever. I'm going to stay in therapy forever. It's like this huge commitment.
Yeah.
Is that always the case, or is this sometimes finite because it's just happening because of this major life transition, and eventually we get past it?
Yeah, so it really varies, right? So some people they're like, I only want to take medication for like this amount of time, and I always try my best to meet people where they're at, and that's totally fine. But then some people end up seeing the benefits of being on the medicine, and they want to stay on it. I typically recommend that people stay on medication from 9 months to a year,
Mm-hmm.
and that's because they can get through all those difficult periods, and then they get into like this better space where they're feeling better, they have better relationships, they have better coping skills, and then at that point where they're doing really great, they can kind of wean off.
Yeah, exactly.
Yeah, so
Awesome.
it just depends on the person, really,
Yeah, for
really.
sure. But it's good to know that, again, at least your style, maybe it's not every practitioner's style, is let's see, and it is individual. And if you don't need or want to be on it forever, let's just deal with the now. Another
Yeah, and I
question. Yeah,
always I always tell people that like I'll always give my recommendations, and it's all ultimately your decision, right? As long as you're not a danger to yourself or others, it's always up to you. So if you decide to stop your medicine, like I'm gonna have to support that while telling you this is my professional opinion.
hmm
So you never have to stay on medication, is my point.
right. Wonderful. Two more things I did not prep you for, but you can roll with it. Is this a matter of, since this is a transition, let's say someone did not seek support and they were struggling with whatever, postpartum, anxiety, depression, OCD, um, and they are saying to themselves, it'll resolve on its own. Does that ever, does that ever happen? Does it rarely happen? Does it never happen?
Yeah, I mean, in my experience, um, it does not resolve very quickly. Like, so it might resolve a year or 2 years out. Um, but I wouldn't recommend waiting things out. I don't think that it has been beneficial in my experience to the individual, the babies, the other partners involved. And then you're kind of just like suffering and you don't really have to.
Yep, absolutely. I think that is a common, like, well, once I get past 6 weeks, any of this baby blues stuff will just go away. But we know that if it's going beyond the first two, that A, that probably isn't what it is anyway, and B, yeah, and then it can become a domino effect, right? And like now I'm not sleeping, and then the not
Right.
getting enough sleep is delaying me moving on from this mood issue. Which brings me to my second unprepped question. Obviously, the main hat I wear is sleep, helping families get adequate quality, adequate quantity, and figuring out why they're not getting it. Can you speak from your experience in education? How big of a factor is sleep? Can it trigger these things, exacerbate these things? Can it help them resolve with or without medication?
Okay, yeah. So sleep is so, 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 so important, especially in the postpartum. Well, throughout the whole pregnancy and postpartum, but like especially postpartum, it's so important to your mental health. I apologize if you hear that in the background.
Hey.
um, but yeah, so like
That
lack
was
of
like right
sleep.
on cue. Like if you're not getting sleep, it's an emergency.
Yeah, lack of sleep can certainly impact mood and anxiety. It can worsen mood and anxiety. Um, and can just like worsen outcomes in the postpartum period. It can definitely impact your relationships and impact your ability to bond to the baby, your ability to function. So it's like so important to prioritize that. And it could also potentially lead to severe mood disorders.
Mhm.
So especially people who have a history of maybe bipolar, sleep is of the utmost importance, but it's definitely important for everyone.
Absolutely. And I think when someone does have a holistic approach like you do, like I know most mental health professionals, they are asking questions about, are you sleeping? How much sleep are you getting? When are you getting it? Um, and of course, it's easy to then say like, okay, but I have a new baby. Did you hear that part? So I'm not sleeping, but there are ways, come find me and my team. We can help. But also there are just ways to, I don't know if you agree, but we always tell moms, if you can find a way to get 4 hours uninterrupted. I don't know what it is about the 4 hour block. I guess it's what the cycles you can go through. Is it enough? No. Is it ideal? Definitely not. But in terms of functionality and staving off or maintaining all these levels that we're talking about, 4 hours uninterrupted makes a huge difference. So if you have a partner,
Yeah.
or you can hire someone if that's within your means, of like, look, I don't
Yeah,
want to be on
doulas
shift
could
for
help
these first four
support,
hours or the
see if
last
you can get a
4 hours. Doulas are fantastic. Yes, yes. And it doesn't have to be, you can think outside the box. My partner at the time was a night owl, so I would, get baby fed, hand him off. Dad would be on duty, and I would go to bed nice and early. It was some people that would work well in the opposite. Maybe if you have a partner, they get up bright and early, so you can actually get your 4 hours on the back end.
yeah.
Um, there are ways to do that usually, and it's really, really helpful. I feel like so I believe I was undiagnosed. I've diagnosed myself that I had all of it, the depression, the anxiety, the OCD. But of course, was suffering as a superwoman back then and a hyper independent woman. I'm now on a recovery journey. So I was like, I'll handle it myself. I will say though, and it did eventually resolve ish. But the main point being, once we got our son sleeping at all and then well, it made a huge, huge difference. And I'm certainly not encouraging anyone that needs to go the psychiatry route to not do it, but just to underscore how impactful the sleep can be. You may not need the rest of it, or it may just mean that the rest of it can do what it's supposed to be doing,
Yeah.
because you are looking at the whole picture. So that's super important. We can help with that. Okay, so a lot of good information for new parents, expecting parents, their partners, their people in their village. Hopefully, we're all watching out for each other. I feel like we're not asking questions, maybe when we need to be, or we're not asking the right questions. I don't remember anybody asking me, whoops, something fell off my wall. I don't remember anybody asking me how I was doing. It was so focused on the baby. How's the baby doing? And
Yeah.
all the appointments were just about the baby. So yeah,
True.
ask how mom is doing. And even if you get an answer you don't quite agree with, persist. So that's everybody's homework today. What is one thing you've learned on your own journey of supporting these women, that we haven't, or however people are identifying, that we haven't touched on yet, that you wish you learned sooner, or you just want them to hear as early as possible?
Yeah. So I just really have learned the importance of like preventative care, planning, and the importance of all the services that are available for moms. Like people don't really, I don't, to my knowledge, tell people about like a pelvic floor therapist,
Mm,
or that there's other people like that can work with the mom and baby to have them have an optimal perinatal period.
yeah.
That there's sleep professionals
No,
available.
nobody talked to me about that. We either already have or are gonna have an episode on pelvic floor health. I am still suffering. So my son's turning 14, and I'm realizing it's been a problem this whole time, and nobody. And when you hear like our birth story, like of course it was a problem, but that was not on anybody's radar. And yeah, it's caused a lot of issues. I
Yeah,
wanted
and
to
you
suffer.
can like come up with a plan. How do you, and things don't always go according to plan, but like how do you want your birth to look?
Hmm.
How can you gather supports? Can you get a doula to be there with you?
Yeah.
Um, do you want to give birth in a hospital? Like
Hmm.
what other options are there? And I just think it's really
Yeah.
important also to just advocate for yourself.
Yeah. And
in
to
this
go,
setting.
that's really helpful. And to go back to the proactive or preventative, as you said, we don't all have the birth experience that we want to have. And that's probably an episode in and of itself. But when it doesn't go according to plan, particularly if it's scary, dangerous, whatever, um, we need to process that, right? And that's another thing I
So
think never
important.
happened for me. I have not processed the birth experience. I think it was less critical for me because everything turned out okay. It didn't go according to plan, but it was all right in the end. Um, but that can really stick with someone and cause a lot of issues. So just another
Definitely.
reason, like best laid plans. Maybe you're not having any mental health issues. You have no history, but who knows how things are going to play out. So just get
Right.
yourself set up with somebody. I won't go on my soapbox, but I think we should all be required to be in therapy.
I was
Be
gonna say, yeah, I was definitely gonna say, like,
all humans.
just get a therapist on
Just
board, like, just so you have one
yes,
available.
if you are functioning as a human being throughout daily life, we all need to process all the stuff that is happening to us and the things
Definitely.
that we're doing and feeling. And we need an outside person to, even if we have the best life, right? There's just processing that needs to happen. So yeah,
For
maybe
sure.
we'll get it right sometime in the future, but definitely for this period. And I hope that somebody hears this. Another thing I didn't prep you for, maybe you'll be good on the fly. If someone is right now, like let's just cover our crisis situation, they're hearing this and they're like, I can't even make it to getting an appointment with someone. Are there great resources that you recommend if someone has a concern about someone else or they're maybe concerned about themselves?
So their postpartum support international has a hotline. I do not know the number
That's what
off
I
the
was
top of
going
my
to
head, but
say.
you can
Yeah.
certainly Google the postpartum support
And I'll put
international.
that in the episode description as well.
Okay. Yeah.
And they have excellent
Um,
online resources, support groups, and yeah.
yeah, they have free support groups for so many different areas that people
Mhm.
struggle with during the perinatal period.
Yeah,
But the hotline is great for people who are struggling and their partners. I would definitely say just reaching out to a therapist or psychiatric nurse practitioner, psychiatrist when you can. Even if you say, like, I'm feeling really bad now, then 2 days later you're feeling better, like, just reach out, establish care, and so you have someone on board
yeah,
on your care team.
exactly. Wonderful. Awesome. Well, that was really helpful. As I wish on every episode, I wish I knew all this before I needed it. I wish I could go back and do things differently, but there isn't not a lot of value in regret. So instead, I am on this mission to, there's no need to reinvent the wheel or all have similar negative experiences. So I hope that somebody hears this today and decides to do it a little bit differently. The worst that happens is everything goes awesome. You don't need that person. And that would be an amazing problem to have. So I will let everyone know where to find you in the description of this episode. I'm sure I'll have you back to dig into some topics more in depth. But listeners, watchers, thank you for your time. I'll be back soon with more things that I and others wish that we knew sooner. In the meantime, I'll leave you with my list of stuff that I learned the hardest way, my short list. The real one is a lot longer. Number one, your to-do list will always be there, so put yourself on it. And our mental health is of course a priority. Two, you can't pour from an empty cup, so schedule ways to refill yours every day. And three, there is no way to be a perfect parent, countless ways to be a really good one. So let's aim for that. And that's all we have for you today. Thanks, everybody. We'll be back
Thank you.
soon.